Welcome back to another episode of Big Brain Time. Today's episode is all about the chemistry of medical mistrust. But before we do that, we have to talk about the 5 ways in which Eminem plays a role in the world of medicine. By rapping about it. Cut. Okay, what now? Why don't we try something new? You know, instead of this chemistry bullshit that you're talking about, what if we talk about the societal problems about medical mistrust? That sounds really boring. Then it would match your personality. Touché. And besides, people need to know how the BS of medicine is impacting their day-to-day lives, not just their insides. So you just want me to rewrite this entire episode? Yeah, but don't worry about it. The editors will take care of it. We overwork them, so it's fine. Okay, fine, but I'm only doing this because it'll seem like I'm Trevor Noah doing a piece on The Daily Show. Oh, you know he left The Daily Show, right? Why would you say that in the middle of shooting? I'm gonna beat your ass. Welcome back to another episode of Big Brain Time. This episode is all about medical mistrust. The reason your immigrant mom says VapoRub is the only medicine you'll ever need. Many communities, especially marginalized communities, have this mistrust of the medical community, and rightfully so. Throughout history, low-income and minority populations have been consistently mistreated by... What is going... Where am I? What is going on? I just got teleported in another interview again, didn't I? Who are you? Why am I here?
I'm a surgeon and an intensivist at Columbia University. My name is Beth Hockman. I figured you were here because you have an appendix problem or a hernia or something.
No, I'm not, but what was it talking about? I was talking about mistrust in medicine, and okay, I'm assuming you have something to say about that.
Yeah, that's something we deal with all the time. I cannot get patients to do what I recommend without having to spend forever talking about why I think it makes sense. It's a real struggle, constantly, every day, and particularly with people from marginalized communities.
You heard the doctor. Medical mistrust is still a thing, but something to note is that the paradigm has shifted. When we talk about people not trusting medicine, you probably hear one of the following from scientists. I can't believe these people don't believe in modern medicine. I mean, it's evidence-based, yeah? Okay, now sure, patients need to take some steps to get educated, but why are we putting so much blame on the patients and not the industries themselves? Medical mistrust is much more complicated than patients being like, yeah, doctor! No, it's more like a cycle of a problem. Here, let's make a circle and call it the cycle of medical mistrust. Cycle of MM. Cycle of Eminem. Cycle of Eminem. I knew Eminem had to do with medicine. It all starts with a medical bias incident. This leads to marginalized communities fearing and not trusting healthcare, which leads to marginalized communities visiting healthcare sites less and less, which leads to a lack of empathy and access to care for marginalized communities, which then leads to more medical bias incidents. Blaming the patient is us coming in and trying to change marginalized communities' fear and mistrust of healthcare, or that right side of the wheel. How well does this even work though? How easy or difficult is it to change a patient's fear and mistrust of healthcare, and how do you see it happening in your practice?
It is a very long and painstaking process. As a clinician, we have to spend a lot of time trying to just understand what people are afraid of and what they're hoping to achieve, which is not necessarily the same thing that I'm specifically hoping to achieve for myself.
So what I'm hearing is you have a lot of one-on-one conversations, a lot of work, but I have the solution for you. It's called the Don't Be a Bitch brochure.
Yeah.
All right,
Okay.
I know what you're thinking. It might come off as a little insensitive, but listen, a little tough love is what we need sometimes. And if they do continue having a problem, you just open it up. Tells them to don't be a bitch.
Yeah, I mean,
it's perfect.
it is. It's pretty straightforward. It's eloquent. Really gets to the point.
See? Do you think you could start implementing this into your practice, say by tomorrow?
A variation of that, maybe.
So you'll think about it.
I'll think about it.
Okay, so then instead of going after patients, what if we went after the left and the top of the Eminem cycle? Yeah, how can we go after lack of empathy shown towards patients of marginalized communities and medical bias incidents that happen in hospitals? Well, for starters, we can increase representation in hospitals. So I've been in hospitals here and there, and let's just say they don't look like the semi-diverse Grey's Anatomy castings that we see on TV. I'm talking to a white doctor right now. How do we get more diversity in healthcare?
Yeah, it's true. It's a big problem that we have not done a great job of addressing. But basically, it starts at the very beginning. When a little kid is going to school, if they're learning about health and medical careers, they might start thinking about it. And if they're seeing people with their background around them or on TV or whatever representing those roles, they might be more inclined to pursue that avenue of jobs. But the path to get there, even if they did find interest in it, is really expensive and hard to get through if you don't have a lot of means. And so it really makes it really hard for people, especially in marginalized communities, to get there.
An article written by CNBC explored these costs even further, and this dude named Eddie Conroy, who's a senior advisor for an education policy program, and who kind of looks like if McLovin went through a rehab program, said that high application fees almost always make it difficult for low-income, first-gen, and students of color to access medical programs. All right, let's go back to the cycle of M&M now. Moving on from breaking it from the left side by increasing representation, we can also look at how to break it from the top. Medical bias and hospital incidents partly happen because of the for-profit nature of hospitals. So how does for-profit healthcare and working with insurance companies affect your ability to properly provide patient care?
It is super painful and wildly confusing. I don't understand any of it, in all honesty. So from an insurance standpoint, everything that I can offer my patients electively, meaning as an outpatient, is entirely based on what kind of insurance they have. And I just find out from the administrative office whether I'm allowed to offer things.
So oftentimes, do you see yourself fighting for patients, getting them the procedures that they need?
Yep, or the imaging, for example. This is largely in the outpatient setting. In the inpatient setting, we just do whatever we feel is necessary, and then I'm assuming somebody's figuring it out on the back end.
Have you ever wanted to physically fight an insurance company?
All the time.
Have you ever done it?
I think I could take them.
You think you could take them?
Totally.
Just
Totally.
you and United Healthcare in the ring, 1v1. That looked amazing to me. I put all my money on you, I'm not gonna lie. On top of that, there are so many stories where hospital for-profit decisions have been made by thinking very little about patient care. For example, did you know that hospitals make more money from adult beds than pediatric beds? So it should be no surprise that hospitals around the country have been getting rid of beds for children in place of beds for adults. Adults that order more tests, request more of the doctor's services, and are more independent in making healthcare decisions. And because of this, children's hospitals have been filling up and are often overcrowded. Okay, let's see. Where else has a hospital done people or other hospitals dirty? Oh, I don't know. Maybe in the middle of this pandemic. A 20-hospital system that had billions of dollars at their disposal received $5 billion from the federal government to help support them. Why wasn't this money given to hospitals that actually needed it?
The world may never know.
Stop holding information back. Look, hospitals are businesses, and they have to stay in business to get patients care, no shit. But making more money at the expense of their patients?
Hell no!
So if hospitals don't make decisions for patients and in the direction of monetary gain, then how can hospitals expect patients to trust them when they recommend vaccines or getting regular physicals or shoving suppositories up their ass? In fact, I don't blame marginalized communities for being skeptical, and I don't blame Trumpies and Karens about being skeptical either. Okay, maybe not that last part about Trumpies and Karens. That left a bad taste in my mouth. So, that's the cycle of M&M. If medical systems can get their living shit together and focus on increasing representation in medicine and diverting away from for-profit decisions that come at the cost for patients, then this cycle could possibly break. Now, let's see if I can get the doctor's approval to make it legitimate.
M&M, like the candy?
No. Have you not been listening to what the other me is saying?
No.
M&M, medical mistrust, becomes Eminem, like the rapper?
Okay, I see where you're going with
Yeah?
it. Kind of makes sense.
Yeah?
But the name is pretty dumb.
You're dumb.
Sphincter says what?
What?
Works every time.
Okay, so I guess that didn't work. I'm gonna go over there, be sad and cry about it. But before I go, thank you so much for watching. That's it for this episode of Big Brain Time. Subscribe. I'll see you later.
Take it down.